Hello, my name is Megan Hunter. I'm going to be your nurse for today. It looks like your doctor has ordered an insertion of a Foley catheter. Yes, ma'am. So what that is it's a small tube that I will insert inside of your urethra. It's just going to help expel any of that urine that's built up and hopefully provide you a little bit of comfort, okay? All right. And I'm performing some hand hygiene, ensuring privacy for my patient. And could you just tell me your name and your date of birth, please? Okay, perfect. Can I just verify on your bracelet there? Awesome. Okay. So what I'm going to do is I'm going to start by getting all my things ready. Are you okay if I expose you now so I can prepare to start the procedure? Okay, perfect. All right. I'm exposing my patient and I'm ready to get started. Ensuring not to bump their legs or to break sterile field. And now I want to start by, I can move this over. Okay. The first thing I'm going to do is I'm going to take my swabs here and get all of my iodine and everything out and ready so that I can clean the patient. So I'm putting it in my tray to have that ready. But I would start off first with perineal care if it is necessary, because some of the patients are sitting there and they do need it. So you always start with peri-care first, then you would start all of these steps. So I'm putting out my iodine. Next, I'm going to put my lubrication inside my box here. Okay. Connect my syringe. Okay. Now I'm all set to move things over to the bed. Okay. All right, I'm going to start off by taking my fingers in my non-dominant hand and spreading the labia. I'm going to hold that there. I'm also going to take my swab. I'm going to start on this side, the side farthest away from me. I'm going to wipe down with one swipe from the clitoris to the anus all the way down. Take my swab back and throw it away. My next swab, I'll be wiping on the side closest to me, straight down from the clitoris to the anus. Take it out, throw it away. And my last one, I will be wiping right down the middle and throwing it away. All right, and next, I'm going to take my catheter. I can now take this out and get it completely out of the way. Okay. When I threw my tray down, I made sure that my gloves did not touch anything on the table because that would be breaking sterilization. Okay. Catheter, making sure that it's lubricated. And I'm going to scoot this closer. I'm also going to pull things out so that I don't get tangled up or bump her legs. Okay. All right, So ma'am, I'm going to insert the catheter now. What I'm going to have you do is you're going to feel some slight pressure, and I want you to bear down for me, okay? All right. Okay. And I saw the flash of urine, so I'm going to insert 1 to 2 more inches. If it were a male, it would be 3 to 4 more inches. 1 to 2 more inches. And now I'm going to move my hand that were originally holding the labial folds down to hold the catheter in place while I inflate my balloon. My balloon is inflated. Next, I would be taking be taking the adhesive piece so that I can clip it to her legs and then set up my bag beside the bed. What I would do is take this out. Okay, now it's attached to the patient's leg, and I'm going to take my bag. Okay, hanging off the side of the bed, and that would be the insertion. Now to remove it, what I would do is I'm going to detach the bag. I'm going to detach it from her leg, and then I'm going to let her know that I'm going to be removing the catheter next. And you would take your syringe and attach it and deflate the balloon. Okay, I would deflate my balloon, and I would let the patient know that I'm about to remove her catheter, so I would place my fingers above her labia folds to hold everything open again and pull the catheter out. Perform perineal care and then you're done.